Hi class, this is Professor Williamson, and this is a video presentation to accompany the PowerPoints related to almost all of the exercises at the end of Chapter 5. This presentation will focus on the code building and the check your understanding. There will be a separate presentation for the case studies at the end of Chapter 5. The PowerPoint slides without the audio will also be posted, which will be easier for you to download to your personal computer or your personal storage device. As you note, Chapter 5 is focused on root operations that alter the diameter or root of it or involve a device. So as you are going through the exercises, the assigned non-graded exercise at the end of Chapter 5, it's helpful to go back to what the focus is of that particular chapter, and that is on these particular set or this particular set of root operations here on the slide. Now, these are only some of the 31 root operations of the whole entire listing for ICD-10 PCS for the medical surgical section. So there may be some additional ones that are used in some of these exercises, but this is the focus of this particular chapter. So if we look at the code building exercises at the end of Chapter 5, the first set of them is a matching exercise. So you're given 11 statements, and you are just asked to basically identify the root operation. You're not going to be coding them all the way out, so to speak. You're not going to be assigning your ICD-10 PCS code. You just be identifying the root operation, which is a term. The first one is an embolization of the uterine artery with gel foam. The first exercise is the embolization of the uterine artery with gel foam. It's helpful if you fully understand or review what is meant by the word embolization. Embolization is defined as the intentional introduction of a clotting material to close or narrow a vessel. In this case, that vessel is the uterine artery, and the surgeon or the physician is going to be using this gel in order to achieve that effect. So that intention relates then to which of those root operations, in this case, one of the selections from the right. The answer when we look at that is occlusion. You can review the definition of occlusion in a variety of locations. It's in Chapter 5. It's also back in Chapter 1. It's also in your coding book. From an ICD-10 PCS standpoint, occlusion is a root operation that is completely closing an orifice or the lumen of a tubular body part. The next one, number 2 and number 3, are related in the sense. The first component is insertion of a cerclage suture. It's helpful if you understand what that procedure is and why it's being done. This is a picture here on the right. They're actually using sutures to close off temporarily the opening into the cervix. This is typically done to prevent a premature labor process or premature birth or pregnancy loss. The woman may have symptoms of bleeding to the extent of there's that possibility. And this is also a temporary measure because they are going to then remove these sutures at a later date closer to term delivery. So it is a temporary measure. When we look at those root operations again that are the focus of this chapter, we find that the best fit is restriction, which is the partial closing off of an orifice, or for this particular anatomy, partially closing off a lumen of a tubular body part. Then later, this woman is coming in, and now she's going to have those sutures removed. Those sutures are man-made material. They're typically synthetic. They also could be nylon or polypropylene. They are going to be non-absorbable because they want them to stay there for the length of time that they need them to be there. So we're coding, or the root operation intention is to remove synthetic suture material, and that relates to the root operation of extirpation, which is the taking out or cutting out of solid matter from a body part. The next exercise, number 4, is patch repair of the carotid using bovine material. So this patient probably has some type of carotid aneurysm, and they're going to use cow biological substance to fix that. The root operation that best matches what they're doing. They're putting in a biological material. It's a biological from an animal, but it's still biological material to reinforce the carotid artery of this patient. That matches up. Best option is the root operation of supplement. Supplement is defined as putting in a biological material to reinforce. Number 5 is the repair of a leaking aortic valve replacement. So this patient already had an aortic valve surgery and had a device put in their body. That particular device, whatever material it's made out of, is not working properly. It's leaking. So the physician and surgeon is going in to correct something that's not working correctly, a device that is not working correctly. That matches up to the root operation of revision. Number 6 is a trach tube exchange. The word, that's how it's written in your book, trach tube exchange. Trach is a shortened word for tracheostomy. So this patient has a tracheostomy tube in their throat to allow them to breathe. They're taking out the old tube and they're putting in a new tube. The root operation that matches that is change. They're taking out an old device and they're putting back in a replacement that is identical. The next one, number 7, is stent placement in the lacrimal duct. So they're talking about putting a stent into this patient's tear duct, typically to expand it. The patient has some tearing issues. We're going to expand a lumen or a tubular body part, as noted here on this slide. And the root operation that matches with that, in terms of definition, is dilation. Dilation is defined as expanding a lumen of a tubular body part. Number 8 is noted in your textbook as urinary diversion, ureter to the skin via ileal conduit. Keywords are the ileal conduit. A conduit is defined as a channel for conveying water or other fluid. So in this case, they are kind of rerouting the urinary stream. The best root operation that matches that is bypass. Again, if you go into your textbook, bypass is defined as altering the route of passage of the contents of a tubular body part. The next one, which is number 9, is placement of an intrathecal pain pump. Again, going back to your medical terminology, exposure, and experience, it's helpful to understand what intrathecal means. Intrathecal means within the spinal cavity or in the spinal canal. So they are putting in some type of device that's going to then funnel pain medication, typically directly into this patient's spinal area called spinal theca. And again, this is putting in this pump to do this functionality. The intention is to do that, and the root operation, the root operation is insertion. Number 10, the patient is having a cystoscopy with the retrieval of a ureteral stent. What is the objective? The objective is to remove this stent from this patient's bladder, or I'm sorry, kidney, urinary system component. Removing the stent from the albuterol. The root operation is removal. And the last one, number 11, is the patient is having a partial thickness graft of skin to the upper right leg. What is the intention? The intention is putting skin graft on this patient's leg. The root operation that matches that is replacement. Now moving on to the which root operation is it? You're given statements and then you're asked to identify the root operation term and the ICD-10 PCS code. So for this presentation, I will be going through some of the indexing steps and the thought process along with that to arrive at the final complete ICD-10 PCS code. The first statement in your textbook is this patient is seen for follow-up of a right tibial plateau fracture treatment with removal of a Sheffield ring by incision. So the intention of the procedure is the first thing you need to think about. What are they intending to do? What's the objective of this surgical encounter? The intention is to remove this ring, which is identified per your documentation as the Sheffield ring. The root operation then is removal. You would index in the alpha index of your ICD-10 PCS coding manual the main term of removal. Then the subterm is going to be your anatomy. Where is this removal taking place from? It's taking place from this patient's tibia. And you also know which leg, in this case right. So when you go removal tibia right, you are given 0 QPG in the alpha index. Then you move to the 0 QP table. In my coding manual, the vendor that I'm using currently, which is the AHIMA code book, the 0 QP table is on 2 pages. So you want to make sure you look at the entire table before you start choosing which row. In your clinical documentation, it states that this ring is being removed by incision. An incision identifies that this is an open surgical approach. That's your next character value. Then you have to decide what type of ring this is, the Sheffield ring. You can do that 2 different ways. One way is to look at the Appendix E of your ICD-10 PCS coding manual because you have a device appendix. You will find that this is an external fixation device. You could also use your favorite search engine to find out what is a Sheffield ring. It's basically an external fracture fixation device for someone who has had a tibial fracture, and they're going to use this ring to stabilize their fracture. So it is external to the patient's body. But to get this off the patient, because they have screws and different mechanisms of attaching this to their bone underneath their skin, in order to remove this device, they have to cut it off of the skin. So that impacts your 6th character value, the type of device, and your final code, because you have no choice but to use Z when you arrive at this table. Your final code is 0QPG05Z. And I just want to mention, just a reminder, I'm not going to keep repeating it in every code, but notice how this code is written. Your Q, your P, your G, your capital letters. This is a 0, 0QPG0, and the Z. So there's no decimal point. All of the alpha characters are uppercase, and the 0 is a 0. It's not an O. The next one is a newborn who was diagnosed with a pyloric stenosis and treated with a laparoscopic polyuromyotomy. It's helpful if you understand what that term polyuromyotomy means and what that word otomy means. It's also helpful if you understand why this is being done. What is the definition, or what's going on with this newborn What is pyloric stenosis? So this child has pyloric stenosis, which is a narrowing of part of the stomach that causes typically the child to have projectile vomiting. So what is the objective of a cutting into the patient's stomach? The objective is to open up the pylorus, to make it wider or larger or more expansive. Therefore, the root operation and the intention is dilation. You're going to index by dilation, then stomach, then pylorus, because it's a very specific location. The word pylorus is in the operation definition, and that specific location is not just the stomach, it's actually the pylorus that is the part that's being narrowed when a patient has pyloric stenosis. So in the alpha index, you're going to end up at 0D77. You're going to move then to the 0D7 table. You already obtained the body part value because you indexed, your subterm was pylorus, so you have the 7 equals stomach pylorus. Then it states in your documentation that this was done laparoscopically. So the surgical approach is then going to be 4. You can go back to chapter 1 to review what does percutaneous endoscopic mean. This basically means they're going to make small incisions in the abdominal cavity. They're not going to go down the patient's mouth to do this procedure. They're going to actually come at the patient from outside of their body, but through the abdominal cavity, and make small incisions to get the laparoscope, which is an endoscopic device, into the patient's body. Then the next character value is reflective of any device that was left in the patient or was being addressed during this procedure. There was no device in the patient to begin with before the surgery started. Yes, they used an endoscope, laparoscope, same thing. They use a laparoscope to do this procedure, but at the end of the procedure, they didn't leave anything in the patient. So the device character value is reflective of 0, which is in ICD-10 PCS, nothing is reflected by the character of Z. So our final code for this procedure on this newborn, this laparoscopic polyuromyotomy, is 0D774ZZ. The next one is a patient who has been on long-term warfarin regimen for atrial fibrillation. The patient now presents for a Watchman left atrial appendage closure insertion that is accomplished via cardiac catheterization. So what is the intention? This patient has atrial fibrillation, has been on a medication, and now they're going to stop giving them that medication probably because of the side effects of warfarin, and they're going to put something into their atrium. And this is a picture of the actual Watchman implant. What is the intention? The intention is to close off the atrial area. In chapter 5 in your textbook, there's some specific information about that procedure. And it happens to be under the root operation that it relates to, which is occlusion. In your textbook, it says insertion of an intraluminal device to close off or occlude the left atrial appendage is an example of using a device to perform the occlusion. This procedure is performed to minimize blood clot formation and atrial fibrillation. So the root operation is occlusion. You're going to index by the word occlusion, then left atrial appendage, or you can also go the same method or the same indexing. You also have an alternative indexing, which is occlusion, then atrium or left. You're given 0 to L7 in the alpha index. You move to the 0 to L table. You already have the body part value because of your subterm usage, subterm indexing in the alpha. The next character value is the surgical approach. It was stated in the clinical documentation that it was done via a cardiac cath. To do a cardiac cath, the physician is going to make a small incision, typically in a blood vessel in the groin area, sometimes in the arm, but typically in the groin. Then they're going to move this catheter via a guide wire, and they're going to move and snake this up to the heart. That type of approach is known as percutaneous. Then your next character value is device. Was something left inside this patient? The answer to that is yes. They left this white, it almost looks like a jellyfish to me, white device inside this patient's atrium. It's within the lumen, so it's intraluminal. Then your last character value is qualifier. When you go across the 0 to L7 row, the only option at the very last qualifier value is for K. So your final code then is 0 to L73 DK. The next one is a patient who has a history of compartment syndrome, who is going to have who's having a tissue expander inserted in the subcutaneous tissue of the left lower leg by incision in preparation for further surgery. What is the intention? Intention is to insert this tissue expander into this patient's body. The root operation is then insertion. You would index by the main term, which is insertion. Then you need the anatomy. Clinical information says this tissue expander was placed in the subcutaneous tissue of the patient's leg, specifically the left leg. When you index by that pathway, insertion, subcutaneous tissue, left leg, lower leg, you get 0JHP in the alpha. Then you move to the 0JH table. How was this done? What is the surgical approach? It says incision. Incision equates to the to the surgical approach of open. Was a device left in this patient at the conclusion of the procedure? Yes. What was that device? A tissue expander. As you move across the row in your ICD-10 PCS coding manual, you choose the value that reflects tissue expander, which is N. And then you have no choice at the end. The last character value is qualifier. There's no choice other than Z. And you end up with a final code for this procedure of 0JHP0NZ. Number 5 of Chapter 5, exercises under which root operation is it? Is a patient with osteoarthritis of the medial portion of both knees is admitted for a cemented unicondylar knee replacement. What is the root operation? What is the intention? The intention is to replace this patient's knee joints, right and left, with a unicondylar device that will be cemented. That equates to the root operation of replacement. You're going to use that as your main term, replacement. And then what are they replacing? Joints of the knee. When you go that pathway, replacement joint knee, in your alpha index, you are given two pieces of codes. You're given 0SRD for the left and 0SRC for the right. So you know per coding guidelines that you're going to have to assign two codes because this patient had both knees done at the same surgical event. Both of these codes are on the 0SR table, so you move to the 0SR table to finish your codes out. But you know at the end of this, you're going to have two codes, one for the right, one for the left knee, and one for the right knee. It states in your, well, actually it doesn't state it, but you know that hopefully know that you have to get someone's knee out. You're going to have to cut, and that would be surgical approach of open. In this particular case, you don't even have to really know that because that's the only option when you get to that particular location on that row on that particular table. Was a device left in this patient at the conclusion of the surgery? Yes. These replacement knee joints were left in this patient. You have to choose something that reflects that. When you get to that particular location on that row, on that table, you choose L for unicondylar. Then the last piece is the qualifier value, and you choose 9 for cemented. And again, because of guideline B4.3, you need 2 codes. The code for the left knee is 0SRC0L9. The code for the right knee is 0SRD0L9. The only difference between these 2 codes is the body part value. Number 6, a newborn is treated for pulmonary valve stenosis. Stretching of the valve opening is accomplished via a percutaneous balloon pulmonary valvoplasty. What is the intention? The intention is tied to the key word of stretching. They're stretching this valve. In this case, the pulmonary valve. That equates to the root operation of dilation. You're going to index by the root operation term, dilation, then the anatomy. And the anatomy is valve and pulmonary. When you go dilation, valve, pulmonary, and the alpha index, you end up with being given 027H. Then you move to the 027 table to finish your code. You already have the body part value. The next character value is for surgical approach. It tells you that it was percutaneous. The body part value that reflects that on that particular row for that particular table is 3. Was a device left in the patient at the conclusion of the procedure? The answer is no. A device was used, the device being this balloon, but the device and the balloon is not going to be left inside this valve. If that were to happen, there would be no blood flow to this patient's pulmonary valve, therefore no blood flow to the patient's lungs and respiratory system. So there is no leaving of a balloon inside of an artery, or in this case a valve, in this case, because that would then not be a good thing clinically for this patient. So yes, a device was used for the procedure, but that's not what's being reflected by this character value of device. The character value of device in ICD-10 PCS reflects a current device already in the patient's body that's being addressed surgically, or a device is left in the patient at the end of the procedure. It does not, what the character value device does not reflect is if a device or devices was used during the procedure. So the answer to that question is no. No device is left in this patient at the end of the procedure. There's no qualifier, so your final code is 027H3ZZ. The next one is a patient has a temporary closure of a portion of the thoracic aorta via intraluminal clamp placed percutaneously. What is the intention? The intention is to temporarily close off a portion of this patient's vessel, and the vessel happens to be the thoracic aorta. We don't want to block it off totally, because again, that would be a case of not a good thing for this patient's continued livelihood. The root operation that matches a temporary and partial closure is restriction. You index by the main term of restriction, then the anatomical information. When you do that, restriction, aorta, and then thoracic, then you're ended up with 2 choices in your ICD-10 PCS coding manual in the alpha index. You have to choose either ascending arch or descending arch. Unfortunately, the authors of the textbook did not tell you that. They kind of made an assumption or a presumption or possibly an error. So I would suggest you go back and make a notation in your coding textbook and you put the word descending, so it should read, a patient has a temporary closure of a portion of the descending thoracic aorta. Because you need to know exactly where at on the thoracic aorta that this particular restriction was done. You can't make a code selection without that information. So if we add that word descending, then we would choose that in our alpha index, and we end up with being given 0 to VW, and we move to the 0 to V table. It states in your clinical information that it was done percutaneously, so that equates to a value of 3 for our surgical approach. It also states that something was left in the patient, and it's an intraluminal clamp. Intra means within, so we're going to choose that related component. Ends up being D on that particular row in that particular table. The only option for our last character value of qualifier is Z. We end up with a code of 0 to VW3DZ. So before we move on to the next one, which would be number 8, I just want to mention you need to take your time. These PCS, when I speak the codes, it doesn't roll off the tongue. You also have to be careful when you're writing your codes out, because V's can look like other characters, other numbers. Z's can look like 2. So you want to make sure you are very clear with your writing of your code so you don't make a misstep somewhere along the way as a coding professional or in terms of submission of your work in this course. So it's important that you write 0 to, be careful with your penmanship and also with your typing with these codes. Again, these are uppercase alpha characters. The next one, which is number 8, a patient undergoes a cystoscopy and repair of a malfunctioning artificial bladder sphincter. Again, this is something where the physician's working on a device that's already been put in the patient in a previous surgical event. We're not coding the insertion of the device. We're coding the fixing of something that is not natural to the patient, something that was put into them. So it's a malfunctioning device. And the root operation then is revision. We index by the main term of revision in our alpha index, revision of device in, and then the subterm would be the anatomical location, which is bladder. We are given then 0 TWB in the alpha index. We move to the 0 TW table. You can confirm your body part value, which you were given in the alpha. It also then, the next character value is surgical approach. It states it was done via cystoscopy. The word cystoscopy equates to the use of an endoscope. The most common way to do a cystoscopy is through a natural opening. So the body part, the surgical approach character value would be 8. The next character value is either going to be for a device left in the patient or a device that the surgeon is working on in this surgical setting, and that's true. If there is a device already there when the surgeon gets to that location, there's something already there, which is this malfunctioning bladder sphincter. We're going to then reflect that and choose the character value of L. The last character value is for qualifier. There's no option other than Z on our table in our row, so we must choose Z. And we end up with the code of 0 TWB8LZ. The next one, number 9, is a transfemoral transcatheter aortic valve implementation using an expandable SAPIN, S-A-P-I-E-N, transcatheter heart valve device. This is a picture of that particular device. It's being used as they have to take out the patient's native or natural aortic valve, and then they're putting in this device to replace it. So the patient has a diseased aortic valve, and they're putting in a mechanical device that also is biological. It has a biological component. So what is the intention? The intention is to replace the patient's diseased aortic valve with this device, which is known as SAPIEN. We're going to index the main term, which is replacement. Replacement, then valve, then the aortic. We're given 02RF. We move to the 02R table. We already have the body part value of F from the alpha. We need to know how it was done. It was done via a catheter. That equates to a percutaneous surgical approach. We're going to choose surgical approach character value of 3 to reflect that. Was there a device left in the patient at the conclusion of this procedure? Yes. You need to know what kind of device it was. You can either use a search engine, Google or search or Bing. You can also look in your Appendix E of your ICD-10 PCS coding manual, and you find out that this device is considered zooplastic, which means it's a device that has biological tissue that's not of the same species of a human. In this case, it's cow or bovine tissue. It's being attached to a stainless steel frame. Per our index, we're going to classify this as a zooplastic device, and we're going to choose that for that particular character value on that table in that row, which relates to number 8 for the character value. There is no qualifier reflective on that table. The only option is Z. Our final code is 02RF38Z. The next one is a patient who is having an open gastric bypass procedure with a root NY limb to jejunum to treat morbid obesity. What is the intention? The intention is to make this patient's stomach smaller via a bypass. They're creating a new route to a smaller component of her stomach area. The root operation is bypass. We're going to index the word bypass, then stomach. We're given 0D16 in the alpha. You move to the 0D1 table. In your clinical information, it states this was an open procedure. You're going to choose 0 for that. Was any device left in the patient? No. They surgically made a new pathway, but they didn't leave anything in the patient's stomach or stomach area. So we choose Z. In your textbook in chapter 5, it talks about the qualifier value when you're coding bypass procedures, and there's differentiations between bypass that are cardiac versus other bypass. It gives you some information about what that means for stomach procedures. And in this case, when we look at that information, bypass, the qualifier value for a bypass is something that's not cardiac. It's under, in your code, in your textbook under guideline B3.6a, it says if in a bypass from the stomach to the jejunum, stomach is the body part and jejunum is the qualifier. So we're going to choose the qualifier value that reflects the jejunum, which is A. We end up with a code of 0D160ZA to reflect this procedure. The last procedure in this set is number 11, and it has to do with an open heart bypass, what we affectionately call a CABG, coronary artery bypass graft. These can be very complex. We'll talk more about them when we get to the cardiovascular section of your textbook, which is, I believe, chapter... hold on one second. Chapter 11. So I don't want you to get frustrated. I want you to try and understand the concepts. It may not be totally clear if you're not really well versed in heart anatomy. But basically, this patient is having an open heart bypass surgery. And the issue you need to think about as they ask you the questions in your textbook, they ask you how many codes would you need. Obviously, you have to think about it a little bit more before you can figure that out. But the first question you really need to think about is, what are the root operations? So this doctor is creating new pathways for this patient's heart, blood to flow to this patient's heart. In addition to creating those new pathways, he's doing that using the patient's own vein, in this case, greater saphenous vein, and a graft from the patient's radial artery. So there's two root operations going on. There's bypass, there's the surgical creation of these new pathways, and how is those new pathways being created? They're taking this vein and this artery graft to do these new pathways. That's what's going on in this picture here, is the grafting of a vein and an artery for our purposes. This is not specific to this particular operation, but this gives you a picture of what they're doing in terms of the grafts are then bypassing. So let's say this patient has a blockage right here in their particular heart anatomy, in this particular heart area. The surgeon is creating a bypass. He's creating a new route of blood flow. So the blood's going to flow down and give flow to this area of the patient's heart, so of the heart vein, so the patient's vessel will work properly. Just like here. So the blockage is somewhere up in here. Sometimes it's in a junction area. So the doctor's taking a vein graft and he's creating a new pathway. So this part of the patient's heart will get blood flow. Everything above it's not going to. So we have several things going on. In this particular case, this patient is having several arteries bypassed. He's having what's called a LIMA, left internal mammary artery, LIMA, to the LAD. LAD is the common abbreviation used in your textbook. Then he's having a left radial artery graft from the aorta to the posterior descending artery, and they're not using artificial devices. They're not using some metal or nylon. They're actually using the patient's own pieces of the patient's own anatomy. In this case, a saphenous vein, typically taken from the leg of the patient, and a radial artery graft. So the patient is donating from one part of their body to the other part of their body, which is the heart. So we have 3 new pathways being done. And also we are going to code the harvesting of the vein graft and the radial artery graft. So for the first code, we're going to code from the left internal mammary artery to the LAD. This is a bypass. How many arteries are being bypassed? Just one. We're going from the LIMA to the LAD. Bypass coronary 1 artery. We're given 0210 in the alpha. We move to the 021 table. There was no device left in the patient. They're using the patient's own anatomy, own veins, and own arteries to do these things. They're not using any mechanical device. And then we have the qualifier value. In your textbook, in Chapter 5, it identifies guideline B3.6b, which states that the qualifier for cardiac bypass specifies the vessel bypass from. That's what's being reflected in this last qualifier value, which is the LIMA. It's going from the LIMA to, so our final code is 02100Z9. Then we want to code the next bypass, which was the aorta to the PDA. How many bypasses were done in this component? Only one, just one. Bypass coronary 1 artery. We get the same piece of information from the alpha, 0210, just like we got above. It was done open. That was given to us in our documentation. Was the device used? Yes, it was the patient's own radial artery. Autologous is self-donation, so we choose A because it's autologous arterial tissue. And again, as in guideline B3.6b states, we're identifying with our last character value where the bypass started. It started at the aorta, and that is identified with the choice of W. So our final code for that component of the procedure is 02100AW. The patient had another bypass. Then the patient had an aortic bypass. They bypassed the aorta to the diagonal and the obtuse marginal. In this case, they use a saphenous, left greater saphenous vein graft. How many vessels were bypassed? In this case, it was 2, the diagonal and the obtuse marginal. So we're going to index bypass, coronary, 2 arteries instead of 1 this time. We're given 0211 in the alpha index. We move to the 021 table. The approach is still open. It stated that in the clinical information. It was open heart surgery. Was a device used? Yes. It was the patient's own vein. The character value that reflects that is 9. Where did it come from? This started at the aorta. Character value for that is W. The final code is 021109W. That reflects the aorta to diagonal and the aorta to obtuse marginal using the left greater saphenous vein. Then, surgically, from a procedure standpoint, in terms of what was done, they had to harvest these pieces. They had to harvest the vein and the aorta, radial aorta first, but that's not typically sequenced first because that's not as involved procedure. They pulled the saphenous vein from the patient's leg. Yes, that's surgical event, but that's not as risky or skill oriented as open heart surgery. So from a listing standpoint, though there is no clear guidelines specifically, but most coders would list the grafting or the harvesting of the arterial left radial artery graft and the saphenous vein graft after the open heart surgery, because when you list something in a hierarchy and you're putting codes in a listing, the ones at the top seem to be more important. So yes, these were done, but typically they would be done listed at the lower listing of the hierarchy of these 5 codes. Is it wrong if you list them first? No, because there's no coding guideline specific at this point that says you must list things that are more skillful, going to cost more time and effort, and will give the physician more reimbursement dollars. You must list those things at the top of the hierarchy. This is just something coding practice does. We've been doing that before ICD-10 PCS. We did that in ICD-9 CM, and we also do it in the other system, CPT HCPCS. So the code for the harvesting of the radial artery is going to go to the root operation of excision. Excision artery left, you're given 03BC in the alpha. You go to the 03B table. It notes in your clinical information this was done percutaneous. Endoscopically, you're going to choose 4. Was a device left? No. Was a qualifier? No. The code for the harvesting or the excision of the left radial artery that's going to be then used for the graft is 03BC4ZZ. Then you have the saphenous vein graft. Main term is excision, vein, and then greater saphenous left, because that's what was in your documentation. You're given the code portion of 06BQ in the alpha. Again, it was documented as being done percutaneous endoscopically. You choose 4, no device, no qualifier, and you end up with code 06BQ4ZZ. So in the end, if we go back, you have 5 codes for this procedure. (02100Z9), 02100AW, 021109W. Those 3 codes identify the bypass that happened in the heart location of the patient. And then the last two codes identify excision of the harvesting of the what ended up being grafts. One was a vein and one was an artery. 03BC4ZZ and 06BQ4ZZ. So again, don't get frustrated if you're not totally understanding. Heart bypass surgery is rather complex, but we will work on that more in chapter 11. This just gives you a taste of that. It's important that you go through the step-by-step, the coding process. It's the same for every single piece of clinical documentation. Some take more time than others because you may have to think about it or figure out something based on the clinical documentation. You may have to use a medical dictionary to make sure you understand to some degree what's going on, because you need to understand the intention, and of course the anatomy has to be given to you by the physician, and then you also have to have the surgical approach. Again, please look out for a different presentation looking at the cases at the end of chapter 5 and chapter 6. If you have any questions on this presentation, please let me know.